This is Dr. Jason Emer. I'm a liposculpture and body contouring expert in Beverly Hills, a cosmetic dermatologist that also specializes in laser and skincare. And we're here today doing a question and answer for cosmetic surgery times on Kybella. Kybella is the newest injectable medicine, deoxycholic acid, which is a natural enzyme made in your liver that's used to detoxify fat. It's approved right now by the FDA for submental or chin fat, which is a hot trending area for people who are looking for fat reduction non-invasively. The question is, though, what will Kybella be used for in the future? Many patients are coming in asking, can Kybella be used in other areas, such as the arms, the stomach, the face? And right now, we don't really know. How Kybella is used is in multiple treatments, and it works by creating an inflammatory response in the fat cells to give a permanent reduction in fat. And the question will be, is that permanent reduction going to be safe in other areas? It's only been studied in the neck fat, and in those areas it takes about 4 to 6 treatments to get a significant improvement, or at least one that's considered optimal. The question will be for patients, is optimal going to be the same amount of treatments in other areas, and will it be safe? Because we worry about whether or not it will affect blood vessels or nerves, or if you'll get a sort of regular improvement in those areas and not create indentations or any scars or any ulcers. And some people are coming in after having liposuction procedures and having irregularities, and they are not able to have another procedure to get improvement. So will Kybella be able to be used in those other areas? The other question that patients are asking me is, how much does it cost? Kybella is synthetically made, and that means that medication isn't going to be cheap. And so will patients want to have this non-invasive treatment that is a little bit more expensive but takes much more time to produce a result than having a surgical procedure which is less expensive and can be done in one treatment and give you the true results? So the question also is, are there other medicines in the pipeline that are going to be used non-invasively for localized areas of fat? We know that there are non-invasive treatments approved like CoolSculpting, liposonics, UltraShape, and now Sculpture, but injectable medicines are on the rise. And there's another medicine that's being studied, which is a derivative of an asthma medication, and so we know there are other things that are out there because there's a big demand for patients wanting something non-invasive, quick, not too expensive, and will give them an improvement in a small area of a concern. And so for this area, specifically the neck, Kybella is the only medicine that's approved as a non-invasive treatment. CoolSculpting just came out with their CoolMini applicator, which is an external device. The next question I'm being asked is, can you combine Kybella with other treatments to get an improved result? And the answer to that is, we don't know. There are many patients who are having liposuction by me, and then I'm combining Kybella as one treatment afterwards and getting much better contouring. Also now with the CoolSculpting CoolMini in that area, will getting improvement with a CoolMini result allow you then to do a Kybella treatment and get even more improvement. So the fact remains that there's a huge demand for non-invasive treatments for fat reduction, including use of injectable medicines to small areas and get improvement. And so in this case right now, the only injectable medicine is Kybella for submental fat. And we will wonder what will happen in the future in other areas and where this trend is going to go. Thank you for that question and answer series, and I look forward to having you guys stay tuned for future episodes and more questions on hot and trending information in the cosmetic world with me, Dr. Emer. Thank you.